How to administer an intramuscular injection. We're going to first off gather our supplies. So that is going to be 2 alcohol prep pads. We have 2 different needle types. More specifically for anything that's oil-based, you're going to need to have an 18 gauge needle to draw it up, and then to inject a 25 gauge 1-inch needle. And then for this example, I chose a 1 ml syringe and a little gauze pad. To start off, we are going to open our luer lock syringe here, and then we're also going to open our 18 gauge needle. We're going to verify the medication we're taking, our dose, and how much we need to draw up. Just to use this as an example, we are going to draw up 1 ml, and we're going to start off by swabbing the top here for anywhere from 10 to 15 seconds is what I recommend. And like I said, for anything oil-based, it's going to be a little bit more difficult to draw up. So we're going to draw it up with an 18 gauge needle, and a syringe. So what we're going to do is we're going to take this luer lock syringe and we're going to screw it on top like so. And we're going to start off by drawing back our dosage. Just so we draw up an adequate dose, our 50,000 IUs is going to equal 1 ml. So in this case, 1 ml. Just to use this as an example though, if you're taking something like testosterone replacement therapy, your dose will likely not be that big per injection. It's going to be probably anywhere between 0.3 to 0.5. So just as a reference range, that top of the plunger is going to be where your dose should be at. So if you're taking, let's say you're taking 0.5, you're going to be right there at the 0.5 mark, the top of that plunger. So back to drawing up our 1 ml. So we're going to draw that air up to 1 ml. We already wiped our vial, so we're going to inject this here. We're going to then invert the vial, push the air in, and draw out that 1 ml. You can fiddle with it a little bit if you need to. Sometimes air gets trapped in there. All right, and then we got our 1 ml. I'm going to set this down, take this out. And I like to draw back a little bit more to get everything out of the actual needle, because this is a pretty thick needle. And then you are going to recap it, and we're going to draw back, make sure we have everything inside of the syringe here. And then we are going to open our 25 gauge needle, and this will be the needle for injection. If you inject with the 18 gauge, it is not gonna feel good at all. So this is gonna be the orange cap. So what you'll do is just screw this on like so. Make sure it's all screwed in there. And then it's best practice to make sure you get all the air out of the needle. So you'll wait till a little drop comes by. All right, so we got our 1 ml of vitamin D in this scenario. So I will show you now how to inject. Right, so for the intramuscular injection, we got 3 sites, 2 preferred sites though. So you can go on the vastus lateralis here, that's gonna be basically your outer quad, right in the middle of your thigh. And then we got our deltoid, so your shoulder. And then lastly, I'll have you stand up, your upper outer glute region, your ventrogluteal region right here. For this example, we're going to use his deltoid. So we'll start off by wiping the site.
I like to make sure that the skin is nice and tight, and then also injecting at a 90-degree angle.
All right, and if we're talking what gauge needle we should be using, I'm going to be using a 25 gauge needle. This one is a little bit shorter because he's leaner. So it doesn't need to have as much depth to it.
About 2 inches below the acromion process is where the injection site should roughly be. I do also want to note that you should pull back on the plunger just to make sure that there is no blood present inside of the syringe. If there is blood present, you're going to want to toss it and redo. In most scenarios, there will be no blood present, so go ahead and push the plunger and inject the injectable. You're going to want to make sure all your needles are recapped.
You're going to want to dispose of these sharps into an FDA-approved container and then dispose of them according to your state guidelines.